A typical breast reduction would be reducing a patient's breast volume by between 30 and 50%, and in some cases more. Hi, my name is Adam Critchley. I'm a consultant breast surgeon. I work at the Royal Victoria Infirmary in Newcastle upon Tyne and also see private patients at the Sheffield Hospital in Newcastle. Today I'd like to talk to you about breast reduction, which is a procedure that I perform frequently and is one of my favourite procedures because patient levels of satisfaction are usually so high following this type of surgery. I see a variety of patients of very different ages who are seeking breast reduction, and the things that I typically hear are that I hate my breasts and I've hated them for a long time, or I've been thinking about this surgery for decades. I feel out of proportion and I find it very difficult to buy bras or clothes that fit. Breast reduction is a very predictable and safe procedure in the right hands. In clinic, I will talk to you in detail about the procedure, everything from how long it takes, what the scars will look like, what your recovery will be after surgery, and I will also take you through lots of different photos of patients of mine before and after this type of surgery so that you can see the transformation that takes place. I explain to patients that it's difficult to know exactly what cup size you will be following this type of surgery, but a typical breast reduction would be reducing a patient's breast volume by between 30 and 50%, and in some cases more. The vast majority of breast reduction patients will keep their nipple, and it also includes a breast lift so that you end up with a much more youthful looking breast with better nipple projection, a raised nipple position, and also better upper pole fullness and a generally more youthful looking breast. One of the most important and unique things that I offer to all of my breast reduction patients is an ultrasound-guided nerve block. I'm a huge fan of these nerve blocks because I can see the massive benefit that they have for my patients, because they mean that patients wake up feeling comfy and that they go home the next day, and patients often say to me that they have only taken 6 or 8 paracetamol since they had the surgery. Such was the level of pain relief, which is fantastic to hear. The ultrasound-guided nerve blocks are performed by my consultant anaesthetist, Dr. Critchley, who is a national expert in this procedure, and he will also talk to you about the risks and benefits of this procedure in detail when he sees you on the ward prior to the surgery.